Hi everyone, my name is Rick McDermott with Senior Solutions Group, and today this presentation is going to be about 2021 Medicare A, B's, and C's. So if you're like a lot of people that are wondering about what Medicare offers and how it works and are confused by all the clutter you get in the mail and by all the ads you see on TV, or maybe from your friends that may be telling you one thing and then your parents are telling you another, and it can get all confusing. We're going to help you sort through all that clutter so you can make sense of it all today. We're going to take about 40 minutes or so feel free to write down notes and feel free to subscribe to our YouTube channel. And this would help get this message out to as many people that would need it and benefit from it. So a little bit about us. We are here in Yakima, Washington, but we have the ability to help you in any state you live in. So we have a mission to help people understand Medicare, and we have a process for that. We are a part of NAIFA, which is the National Association of Insurance and Financial Providers, and we are also a part of NAHU, which is the National Association of Health Underwriters. So we want to make sure you're kept up to date with the most current and pertinent information possible. So we love helping people with Medicare, and today we're going to keep it real simple and basic, and so you can really kind of get the nuts and bolts of how Medicare works. So with Medicare, we have helped people since 1995, and it can be very daunting for a lot of people. Medicare has a book they put out called Medicare and You every fall, and a lot of people get confused by that book because at the back of that book there are about 30 or 40 pages of all different types of plans, and it can be very overwhelming. So we'll just really keep it very simple. If you have questions, feel free to reach out to us, and we'll do our dead level best to try to answer your questions as best as we can. And by the way, that's Frankie right there. He is our office mascot, and my beautiful wife Tanya, who works with our team as well. And we also have Faith, our daughter, and we have Nick, our son-in-law, who's married to our other daughter, as well as my sister Tammy. So we are actually a family company. So overviewing Medicare, there's different parts. The main parts of Medicare started out with Medicare Part A and B. That's original Medicare. And we'll also talk about how to fill in the gaps in Medicare. Medicare can be like a piece of Swiss cheese, so you can fill in the holes so you're not stuck with big bills in the future. We're going to talk about different Medicare supplement plans and help you pick the best plan for you, or at least understand how they work. And then we'll also talk about Medicare Advantage as well as Medicare Part D, and then we'll have a summary at the end. We're also going to have a bonus period at the end of this discussion to show you how to navigate, how to pick the best drug plan for you as well. So should you or should you not sign up for Medicare? That's a question that each person has to ask themselves. So if you don't have coverage from your employer or from your spouse's employer, delaying Part B of Medicare may mean higher premiums due to late penalties. So then you'll also have to pay for your health care all out of pocket. If you do have coverage through work or from an employer, you can delay your Medicare enrollment with no penalties. So you can work until you're 85 or 95 if you wanted to. And there's no late penalty as long as you apply within 8 months of losing your employer coverage or your spouse's coverage. So if you don't have coverage, you probably want to enroll in Medicare. If you do have employer coverage, you may not need to enroll in Medicare based on your situation. And there's no penalties for doing so later on. Enrollment is automatic if you're on Social Security, so you don't have to apply for Medicare if you're already on Social Security benefits. Enrollment is not automatic if you're not on Social Security, so you need to apply for Medicare through Social Security to be enrolled in Medicare. And once you enroll in Medicare, you'll get a red, white, and blue card that looks like this with a unique Medicare ID number. And then on the back of the card, you have the option of rejecting Medicare. So if you're working or if you have employer insurance and you get a Medicare card with both Part A and B, you can actually reject Part B and sign up for it later on with no penalties. So there's the initial enrollment period, which is a once-in-a-lifetime enrollment period. There are actually 3 different types of enrollment periods that we're going to discuss today in detail. The first is the initial enrollment period, which is once in a lifetime. So this only happens once in your lifetime. So if you miss out on your initial enrollment period due to working through an employer, don't fret, you'll have a special enrollment period which you can utilize at that point. The initial enrollment period, we're going to use the month of January of 2021 since we're in January of 2021. If your birth date's in January of 2021, your enrollment period started 3 months prior to the month of January. So on October 1st, your initial enrollment period started. So you could apply for Medicare starting October 1st, as well as a Medicare Advantage plan, or a Medicare Supplement plan, or a Medicare prescription plan. Then you also have the month of November. The month of December would have been a good time to really get cracking, because if you wait till January, you may have a gap, or a 1-month gap when your Medicare starts. So you may have 1 month with no insurance, but there is no penalty if you do so. Then there's another grace period of February and March and April. So April 30th is your last day to utilize your initial enrollment period if you're born in the month of January. Unless you're born on January 1st. Then you actually have a month early to start the process, which would be September 1. So anyone born on the 1st of the month gets to start a month early. So once you're enrolled in Medicare, then you'll have a annual enrollment period, which will happen every year. So during October 15th through December 7th, we are very busy helping people review their coverage. So a lot of times people will sign up with an agent and they'll never hear from them again. During this time frame, you can reach out to us or your agent if you have an agent and review your coverage. So a good agent will do their dead level best to make sure you're always on the best plan on a year-to-year basis. So during this time frame, you can join or you can leave a Medicare Advantage plan, or you can make changes and add or remove prescription drug coverage without any restrictions. Then, during the special enrollment period, that would be for certain situations if you qualify for a low income subsidy, or if you move in or out of state, or if you move from one county to the next, you may be required to change your plan by law. So you'll have a special enrollment period or a window of time to do so. There is another period called the open enrollment period, which is different from the annual election period. That goes from January 1st to March 31st of each year. So if you bought a Medicare Advantage plan, or if you're enrolled in a Medicare Advantage plan, you can disenroll from your Medicare Advantage plan up until March 31st. So if you decide, well, I don't know if we really want that plan, you have one more do-over period that goes through March 31st, from January 1st to March 31st. So you can change to a different Medicare Advantage plan, or you can go back to original Medicare, and that would be effective the first day of the following month. So that is another period that is a lot less known, but that is another election period which happens each and every year. So again, if you're not retiring at age 65, you can decline Part B and there's no penalty, and you'll have 8 months to enroll in Medicare once you lose your insurance through your employer. Now we're going to transition into the main parts of Medicare. There's a pie here, and there's 4 different pieces of the pie. So there's Part A, which is the original inpatient part of Medicare, which for hospital stays and skilled nursing care stays, Part A is specifically for that. Part B would be for outpatient visits. So if you have a doctor appointment, if you need lab work, if you need a same-day surgery, if you need chemo or radiation, that would be under Part B of Medicare. Then there's Part C and Part D. So these are optional parts of Medicare. Well, Medicare is optional to begin with, but I don't recommend not having Medicare if you don't have employer insurance. So Part C would be a privatization of Medicare. So you have the option in many counties throughout the U.S. to sign up for a Medicare Advantage plan. And you may see commercials on TV a lot about Medicare Advantage. A lot of those ads you see on TV only offer Medicare Advantage. So they are very slanted toward Medicare Advantage. We are not going to present this as a one-size-fits-all solution. Everyone's got a different situation. Medicare Advantage may be a good option for you, it may not be. So it really depends on your situation and your preferences. Medicare Part D would be a standalone prescription drug plan, or it could be integrated in a Medicare Advantage plan as well. So Part D would be for drug coverage only. So Part A is typically free. There's usually no cost for Part A to have the insurance. That would cover you if you're actually admitted by a doctor and not just kept for observation into a hospital. So if you're kept for observation purposes only, so if you have chest pains, you go to the ER and they send you upstairs to a room, you may not be admitted. You may only be kept for observation purposes. So if you're under Part A, then that would be covered under Part A of Medicare. If you're in for observation, that would be under Part B of Medicare. There is a cost for Part B. For 2021, it's $148.50 for most people, unless you have a high income or a low income. We'll discuss that a little bit later in more depth. There are also Medicare supplement plans which are lettered, so don't get these letters confused by the different types of Medicare Part A, B, C, and D. These are supplemental plans which we'll discuss a little bit more later on as well. So Medicare Original Part A of Medicare covers inpatient care, skilled nursing care. That would be for short-term visits only, no long-term care. So I used to be a social worker in long-term care, and a lot of people think that Medicare covers long-term care, and it does not. There is no coverage for long-term care under Medicare, only short-term rehab visits following a 3-night hospital stay. Days 1 through 90 are always covered for the hospital under Part A. Days 90 through day 150, and these are pretty rare. Most people don't spend more than 90 days in a hospital, but it can happen, and it has happened. I've had clients that have spent way more than 90 days in a hospital. I had a client that had a heart replaced, a transplant, and a kidney transplant all in one day. So it can happen, and it has happened. That bill, by the way, for the hospital alone was $11 million. So very expensive. So Part A does not cover private rooms, personal care items, TVs are usually included, but cable is not, or you won't be able to get on Showtime or HBO. That is not going to be covered by the hospital, obviously. Custodial care is not covered as well. That would be day-to-day care for people who might have Parkinson's, Alzheimer's disease. That is not going to be covered by Medicare. So once you're admitted to the hospital, typically what will happen is you might go to the ER first. That would be under Part B of Medicare. And then they would admit you. And once they admit you into the hospital, you're going to have a deductible of $1,484 each time you're admitted to the hospital. So if you only have Medicare, you would be responsible for $1,484 in 2021 each and every time you're admitted to the hospital, unless the hospital stay is within 2 months. So if you have a heart attack and have open heart surgery, and then 2.5, 3 weeks later, you go back to the hospital with complications, you won't have to pay another deductible. But if you go back 2 months later, you will have to pay another deductible, unless you have a good Medicare supplement plan, or you may have a Medicare Advantage plan with hospital copays, which may be less than the deductible. So then if you're in the hospital for 61 to 90 days, you'll see that this, ouch, that's $11,130 that you may have to pay out of pocket for that stay, on top of the deductible, on top of the ER visit, on top of the ambulance bill or the airlift bill, which could be astronomically expensive. Then if you're in the hospital for your lifetime, once in a lifetime reserve payment, you may have to pay another $44,000 out of your pocket. Again, you could go broke with these bills if you just have Medicare. After day 150, you're going to pay the full bill irregardless, unless you have a good supplemental plan. So Medicare Part A also covers short-term visits in a skilled nursing care facility, where I worked as a social worker back in the mid-90s. So when you are hospitalized for at least 3 days or 3 midnights, that's the rule, and enter a Medicare-approved skilled nursing facility, you may have benefits for the first 20 days at 100% and you pay nothing as long as you're improving. So if you have a massive stroke or have a relative that has a massive stroke, they may not get better no matter how much physical therapy is administered. So they have to chart that in the notes, in the chart notes, and by law, Medicare will not cover that event if that person is no longer responding to the therapy or the treatment. From days 21 through day 100, as long as you're still getting better and making headway and making progress, Medicare will pay, but you're responsible for $185.50 each and every day for the next 80 days, or as much as another $14,840. So you can see this is really adding up quick. And if this happens twice during the year, it could double your cost out of pocket if you just have Medicare. Medicare Part A also covers terminally ill patients who are under hospice as long as your doctor certifies that you're terminally ill. Medicare Part B, as in boy, is the other part of original Medicare, and this is the part that does have a monthly premium, which usually comes out of Social Security unless you're not on Social Security, $148.60 a month for most people. And this covers doctor visits, lab work, if you need preventative care such as a colonoscopy or mammogram, prostate screenings, cancer screenings. Those are covered 100% by Medicare, by the way. Medicare only covers one lifetime physical per lifetime, and they call it the Welcome to Medicare physical. You must get it within the first year that you're on Medicare. So Medicare doesn't cover annual full-fledged physicals, but they do cover routine preventative care for diseases such as cancer, diabetes, things like that. So Medicare may cover durable medical equipment, like if you need a hospital bed or a wheelchair or a CPAP machine. So Medicare pays typically 80% of what they approve of the bill. So if the bill, you might see medical bills come in the mail, it might say the cost for this treatment's $1,000, but Medicare only approves $500. You would be responsible for 20% of the $500, not of the full $1,000. So most providers will write off the other $500. Unless you go to a provider, about 2% don't accept Medicare assignment, or they don't fully accept Medicare, they only partially accept Medicare. 98% of doctors that take Medicare fully accept Medicare, so you'd only be responsible for 20%. I shouldn't say only, because 20%, we don't know what that is. That could be a little bit, it could be a lot. So Medicare doesn't cover dental or vision or hearing. It doesn't cover custodial care, and it doesn't cover care outside of the U.S. in most cases. So for people on Medicare, most people, again, will pay $140, actually it went to $148.60 this year. We need to update on our slides here. And then for people who have higher incomes, they may pay more out of pocket for their Medicare Part B based on your income from 2019. So they go back 2 years. So if you're on Medicare and you have to pay extra, that's based on your income from 2 years back. So if you had a 401k that you took a big distribution on, you may have a hit for 1 year where you have to pay a higher Medicare premium for 1 year only, then it'll drop down the following year. So just be aware of that. So in 2021, your responsibility for Medicare, if you're in the doctor's office for the first visit of the year, is the initial $203 deductible. So Medicare won't pay anything until you hit that $203. It went up from $198 to $203 in 2021. Then after that, Medicare will pay 80% of what they approve, and you'll pay 20% of the bill if you only have Medicare. And then if you go to one of the 2% of doctors that don't accept Medicare completely, you may have to pay an additional 15% if they don't accept Medicare assignment. So you would pay 100% of the 15% in addition to the 20%. But those providers are pretty rare nationwide. So you can check with the provider, or you can go to Medicare.gov and look up your doctor as well. So Medicare Part B also covers blood, home health care services for durable medical equipment as well. No care outside the U.S. though, unless you have a good Medicare supplement plan or a Medicare Advantage plan, which would help cover foreign travel emergencies. So this is a chart which will give you kind of an overview of your options. So once you've enrolled in Medicare, then you need to decide. Step 1 is to enroll. Step 2 is to decide if you need additional coverage, and there's 2 ways to get it. You can use option 1 or option 2. Option 1 would be a Medicare supplement plan, which works in tandem with your Medicare card. So Medicare is the hand, the supplement is the glove. If Medicare pays, the supplement pays. If Medicare doesn't pay, by law, neither can the supplement. So no dental, no vision, no hearing aid coverage on Medicare supplement insurance because Medicare doesn't cover it. But if you have a heart attack, a stroke, or cancer, it's going to pay like a slot machine if you have a good plan. So these plans are standardized. So the federal government has standardized the Medicare supplement plan options. So there's different letters. Depending on the letters you select, it doesn't matter which company you select, it matters which letter you select, and we'll go over that in a little bit. Also, when you're new to Medicare, you have 6 months to pick a Medicare supplement plan in most cases. Otherwise, you may have to answer several health questions to determine if you're eligible or not due to pre-existing health. So most people have one time per lifetime to pick a Medicare supplement plan out with no health questions. Then you can add on a Part D drug plan in addition, which would be a separate plan. So you'd have 3 cards. Your Medicare card and your supplement card would go hand in hand with each other. They'd work in tandem. The drug plan would be all by itself. It would work only for when you get a refill at your pharmacy or if you get mail order drugs. So people may be tempted to skip Part D if they don't take drugs or if they only take a couple generic drugs. I highly advise you not to do so unless you have VA benefits, because you may pay a lifetime late penalty for the rest of your life if you change your mind later. And the longer you wait, the bigger the penalty. And the government's not going to hold your hand and tell you you have a month left to do so. Get cracking. You have to take the initiative. And we're here to help as well. Don't ever hesitate to reach out to us if you have any questions about any of this stuff. There's no such thing as a silly question, folks. Just ask the question. We'll do our dead level best to answer that question for you and help you as best as we can. The other way to get Medicare benefits is through a Medicare Advantage plan, which we are seeing a lot of commercials on TV and Joe Namath and all those ads. If you call those 800 numbers, that's great, but just be advised they will probably push Medicare Advantage and nothing but Medicare Advantage. Again, this is not one size fits all. Medicare Advantage may be a good option for you. It may not be. There are some pros and cons to all of this, so you just need to be aware that the ads are never going to tell you the negatives. They're only going to tell you the positives. So Medicare Advantage may cover additional benefits in addition to Medicare, like dental and vision, hearing, gym memberships, over-the-counter vitamins, things like that. But you may pay a lot more out of pocket if you get sick under Medicare Advantage. And you may have to go to a doctor that is on the plan, like an HMO plan. You would be required to go to all in-network providers unless it's an emergency. With a Medicare supplement plan, you can go to any provider as long as they take Medicare with no referrals needed. So you may need to get a referral to see a specialist with a Medicare Advantage, and you may have to go through more prior authorization hoops to get certain procedures approved by the plan. So just be aware of that. Most Medicare Advantage plans also cover prescription drug plans built in as well, but it's not required. So you can sign up for a Medicare Advantage plan with no drug coverage. However, be aware you may be tempted to apply for a separate standalone drug plan. In other words, a la carte, like you do with a supplement plan. You're not allowed to do so by the federal government. If you sign up for Medicare Advantage and you apply for Part D on its own, you will be disenrolled from your Medicare Advantage plan. So be aware of that. Also, if you're on a Medicare Part D drug plan and you apply for a Medicare Advantage plan, you'll be disenrolled from your drug plan automatically by the government because you can't have two separate drug plans running simultaneously. The government doesn't allow it. And you can't have two Medicare supplement plans. The government doesn't allow it. If you do, you'll be paying money for nothing. Also, if you call those 800 numbers and you enroll in a Medicare Advantage plan, they may not advise you that you must cancel your Medicare supplement plan on your own. So you might get to the month of June or July and say, hey, what's this coming out of my bank? I thought I had the Medicare Advantage now. If you don't cancel your Medicare supplement plan, you may end up having to eat those premiums that you paid, and it could mess things up. So just be aware of that. You need to be aware that you have to take the bull by the horns. Of course, if you use us as your agent, we'd be more than happy to help you with all of this. But there's a lot of moving parts to Medicare, and we just want to make sure you understand how they all work as best we can. So with Medicare supplement insurance, also known as Medigap, these are sold by private insurance companies. So this is a private solution to help you not go broke if you get sick. So they work with original Medicare A and B, and they can't be combined with Medicare Advantage like we just said. And they don't include prescription drug coverage, so you must add that on separately. These are 10 standardized plans. This is a chart, which is a nationwide standardized chart. You'll see these letters A, B, D, G, K, L, M, and N. So if you're new to Medicare in 2020 and beyond, you are not eligible for Plan C and Plan F. That's only for people that are already on Medicare prior to 2020. So we're not going to discuss every single one of these plans, but just be aware, don't confuse Plan A, B, and D and Plan C with Medicare Part A, B, D, and C. So those are supplemental insurance plans. Plan F over here on the right is, you can call that the Cadillac plan. It pays 100% of what Medicare doesn't cover. It even covers the $203 deductible, but that plan is no longer available if you're new to Medicare after 2020. Plan G is the next plan closest to Plan F, and that pays everything just like Plan F does, except for the deductible of $203. And there's also a high deductible G plan as well. Plan N is another option we're going to discuss in a little bit more detail as well. So with Plan G, you can go to any doctor. There's no networks, there's no referrals needed. You just have to pay your annual deductible, which in 2021 is $203. Then after that, there's no co-pays, no bills. It's the same coverage nationwide. It has foreign travel emergency coverage. You have to choose a standalone Part D drug plan. It's not built in. The benefits are guaranteed for life. So you'll never get a letter like you may with a Medicare Advantage plan saying the co-pays are changing or the doctor is leaving the network. So it's very stable, very predictable. The only thing that can change is the annual Medicare deductible, which went up $5 from 2020 to 2021. And your monthly premium will change usually on an annual basis. It might go up 5% one year, 3% the next year, 8% the next year. Some companies are having higher rate increases under Plan G. So another option, and oh, by the way, some plans do have gym benefits, but they never cover dental, vision, or hearing benefits under Plan G. So another option to alleviate higher premiums with Plan G is to consider Plan N. So a lot of our clients are switching from Plan G to Plan N. And some states, most states actually have to go through a health questionnaire if you're outside your 6-month open enrollment window. In the state of Washington, you can change from Plan G to Plan N or from Plan G to N to Plan G at any time with no health questions, as long as you're currently on a plan. So Washington is a very unique state in that regard. There's no health questions, no pre-existing conditions. You can go from G to N or from N to G or from N to F or from high deductible G to regular Plan G or from Plan G to high deductible G at any time during the year. But that is not the case in most states, so just be aware of that. So with Plan N, it's very similar to Plan G. It pays 100% just like Plan G does, except for a maximum of $20 copays. It might be a zero copay, but never more than $20 guaranteed for life. That's only for office visits. So if you have a surgery, a hospital stay, you will not have to pay anything above the $20 for the doctor care, for the doctor visit. And there's also a $50 ER room copay. So if you're admitted to the hospital, the plan will waive your ER room copay as well. So under Plan N, really all you'll have out of pocket is the deductible, which is the first $203, and up to $20. So if you go to the doctor 4 times a year, that's $80 out of pocket maximum. Maybe less than 80, but never more than $80 guaranteed for life. And your premium might be about $50 less a month or more than Plan G. So that's a good way to save a good chunk of change looking at Plan N. They're both great plans. The only other thing you need to be aware of is under Plan N, there is an excess charge if you go to a doctor that only partially accepts Medicare, which about 98% of doctors accept Medicare fully in the US that take Medicare. And you can check with your doctor, or you can go to Medicare.gov to verify that as well, because all doctors are listed under Medicare.gov on Medicare's official website. So there's also an option to get a high deductible plan, F or Plan G. If you're new to Medicare, it would be high deductible G in 2020 and beyond. You would have to pay the initial deductible of $1,484 before the plan kicks in any money toward your claim. And if your health event happened at the end of the year and it bleeds into the following year, you might have to pay that back to back 2 times. So just be aware of that. A little bit about Medicare Advantage. So Medicare Advantage plans cover all of your benefits for Part A and B, and the premiums don't change based on your age and your health. So when the plan contracts with Medicare in the county you reside in, then that plan is going to have the same premium for everyone unless you have a low income subsidy. And it also will cover additional benefits that aren't covered by Medicare, such as vision, maybe hearing aids, gym membership, and other benefits that Medicare doesn't cover. There are some plans that will even pay your Medicare Part B premium in certain small segments of the country. So just be aware of that. Those are small segments of the country that have that. Usually those are highly densely populated areas such as Florida, where there are a lot of seniors that live in those areas. So those ads you see on TV and usually they aren't applicable to every situation for every person. And of course, Medicare Advantage plans will usually cover prescription drug coverage as well. So with a Medicare supplement plan, there are no networks. You can go to any doctor that accepts Medicare. You may just have to pay the deductible if you sign up for Part G or Plan G. You can choose any drug plan you wish, and it's the same coverage nationwide. No ifs, ands, or buts. Very stable benefits, very predictable. So people that would rather pay a higher monthly premium would be attracted to the supplement plans if they're looking for more stability for their healthcare cost down the road with no ifs, ands, or buts. These plans are guaranteed renewable for life. They can never pull the rug out from underneath you unless you stop making your monthly payments. Typically, there's no dental, vision, or hearing. There is none, unless you pick a plan that does have a gym membership, or some plans might have some vision discounts and hearing aid discounts, but there's no full-fledged dental or vision coverage. With the Medicare Advantage plans, these plans can change from year to year, so plans can come and go. Just be aware of that. You might sign up for one plan 1 year, and then 2 years later, the plan might say, well, we're done, we're leaving. So then you're going to have to find either a new Medicare Advantage plan, or you'll get a letter in the mail which will give you the right to get a Medicare supplement plan. Now these plans, you will have copays for hospitals, for doctors, for MRIs, for cancer treatment, up until you hit a maximum out of pocket. We call it a MOOP. Once you've hit your maximum out of pocket, then your copays will dissipate for the remainder of the year for your health care. So the doctor may accept the plan one day and may not accept the plan the next day. You just got to be aware of that. With a HMO plan, that may be an issue for people where they have to find a new doctor. If you go with a PPO plan, that would give you more options for more providers. So you can go out of network if you select a PPO plan. So the premiums on Medicare Advantage can range from $0 up to over $300 a month. How does the plan operate for $0? Well, these plans are federally subsidized, plus they also get your Medicare Part B premium as well. So the premium that you pay, it might be $10, $20, $30 a month, or even zero, is just the tip of the iceberg for how the plans get funded. So with these plans, you're going to have more copays if you get sick. With these plans, you're going to have few or maybe even no copays if you get sick, but you're going to have a higher premium. With the supplement, you can go to any doctor that accepts Medicare. With the Advantage plan, you must make sure your doctor's in the network unless you have a PPO plan or a POS plan, which is like an HMO with a little bit more flexibility. I know this is all very confusing for some of you. Feel free to rewatch this or give us a call. Feel free to, again, subscribe to our YouTube channel as well, and also our Facebook page. So to be eligible for Medicare Advantage, you must live in the county where the plan's offered, and you must have both Medicare Part A and B, and this has actually been discontinued in 2021. Prior to 2021, you could not have end-stage kidney failure. Now you can have end-stage kidney failure and enroll in a Medicare Advantage plan. So that's new for 2021. So Medicare Advantage cost, you have to continue to pay your Part B premium, which is usually $148 a month. And then you also have to pay the premium that the plan requires as well, which varies from plan to plan. And they may change from year to year. And the cost sharing varies from plan to plan, unlike Medicare supplement plans, which are uniform from company to company. So the benefits can change from year to year as well, and your doctor must be in the network on many plans, especially if it's an HMO plan. So you want to just make sure you do your due diligence when you're looking at Medicare Advantage plans, so you're not surprised if you get sick later on. So we talked about HMOs. These are plans where you must go to providers that are in the network unless it's an emergency or urgent. The PPO plan gives you more flexibility. So you have the option to go to non-network providers, but if you go to an in-network provider, you're going to have lower cost sharing. Special needs plans are only available in certain areas if you're in a chronic condition like diabetes, or if you're in a nursing facility like a nursing home, you may be eligible for a special needs plan, or if you're on Medicaid or low income and you qualify for state Medicaid assistance. Part D. So with Part D, most people will pay just the monthly premium, and the plans may be as low as $6.30 a month in some states, and they could go over to $100 or more a month. So with Part D, there may be an income adjustment as well based on your income. If you're single and you make more than $88,000 in 2019, you may pay an additional $12.30 a month. So based on your income from 2 years back, if you're married, you'd be in this middle bracket right here. So just be aware of that as well. And this would be in addition to any late penalties if you wait to enroll in Part D after you're first eligible for Part D. So again, apply for Part D when you're first eligible to avoid the late penalty. Now, if you qualify for extra help, you will not have to pay the late penalties. So you may not even have to pay the premium at all for the plan. So that might be an additional benefit you could qualify for. So Part D is voluntary, but there's a 1% penalty for every month that you wait to enroll in Medicare Part D. All plans must cover all categories of drugs. So if there's a certain type of drug you're on and the plan doesn't cover it, they will cover a similar drug by law. So you just got to be aware that not every plan covers every single drug. No plans cover every single drug, but there will be a similar drug that will be covered by the plan no matter what plan you're on. And there's over a couple dozen drug plans in every county of the U.S. and every state of the U.S. to pick from. And we have a tool that can help you find the best drug plan for you. And Medicare.gov is another great tool to use as well. So in 2021, there is a standard deductible of $445. And that deductible will be what you must pay out of your pocket before the plan pays. Typically, what most plans will do, though, is they'll waive the deductible if you're on generic drugs such as blood pressure, lisinopril, or if you're on a cholesterol drug such as atorvastatin, or if you're on a maintenance drug for hormones, it might be waived. But if you're on a more expensive brand name drug, you're typically going to have to pay the initial deductible one time a year. Then there's an initial coverage period which goes up until the total cost of your drugs equal $4,130 for the year. So this can be really confusing for a lot of people. I'll try to keep it real simple. If you're on drugs and they're $400 a month, that would be $4,800 for the year, or $4,200 for the year. You will have hit your initial coverage period and you'll go into the coverage gap. And during this period of time, you'll have to pay 25% of the bill. So once you hit the coverage gap of $4,130, and I've had clients that have hit their coverage gap after 2 months or even 1 month. We've had clients that have been on specialty drugs, which an injection could be $2,000 each month. You would go from here to there into the catastrophic phase, maybe within 1 or 2 months. So once you're in the catastrophic phase, you will pay 5% of the cost of your drug or a small co-payment until the year ends, and then guess what? It starts all over again the following year. So this can be a little bit confusing, to say the least. Probably the most important thing to remember is we have a process to help you get the best plan for the least amount of dollars, not only when you refill the drug, but on a month-to-month basis with the insurance plan. And we can review that each and every year as well. In 2021, there is a new senior savings model. So people that are on insulin, their costs may be reduced by well over 60%. So on many plans, insulin costs are going to be reduced down to $35 from day one. So you won't have to pay the deductible, which last year was $435. This year it's $445. And so your cost for insulin might go from $675 down to $230 approximately in 2021. So it's important that you pick a plan that participates in the senior savings model to take advantage of that savings on insulin. And if you're on multiple insulins, like 2 insulins, that could really add up. That could double your savings if you pick a plan that is a participating plan. So you may not need Part D if you have employer group coverage, which most people don't, but if you have VA benefits, you can elect to not enroll in Medicare Part D, and there's no penalty if you change your mind later on. So just be aware of that. And then the Medicare Part D could be a standalone plan or a Medicare Advantage plan benefit as well. And again, if you enroll in a standalone Part D drug plan, you will automatically be disenrolled from your Medicare Advantage plan and vice versa. So the plans can vary from plan to plan. Some plans cover the donut hole or the coverage gap, but we can review that on a case-by-case basis. So if you have a prescription drug plan currently, you can review that on Medicare.gov, or you can utilize our drug plan lookup tool on our website as well at seniorsolutions.net. Again, that's seniorsolutions.net, where you can compare your co-pays, your co-insurance, and your deductibles, as well as your monthly premium, and look at your total cost for the year to make sure you're on the best plan for you on a year-to-year basis. So a formulary is a list of drugs that each and every drug plan utilizes, and every plan has their own unique formulary. It's not one formulary for all plans. Each plan has their own unique formulary, which must be in compliance to the government mandates for minimum coverage for all drug categories. You may qualify for extra help based on your income. If you have questions about that, feel free to reach out to your Social Security office. There's an online application which we help people with every day as well. If you need assistance with that, reach out to us as well. You can contact us at 509-494-4288. So that's going to wrap up the initial portion. Now we're going to go over some bonus material here. So if you want to reach out to us, here's our phone number on our website at seniorsolutions.net. Here's our phone number, 509-494-4288, or our 800 number, 800-940-3657. So on our website, we have lots of good information We have updated Medicare news. We have videos that you can watch, like the one you're watching now. So we'll have lots and lots of different options for you to educate yourself. And that's the name of the game, education. We're not here to sell, we're here to educate. And of course, how we earn our living is if you enroll through us. But we really want to make sure that you understand that your needs come way before our needs. So if we can help you find a plan that is not a plan that we offer, we're going to steer you toward that plan as well. So if you want to enroll in Medicare, we also have a Medicare Let's Get Started tab, or you can click the Enroll in Medicare tab right here. And we will give you a step-by-step, easy process to enroll in Medicare online. We'll give you the link to the Medicare enrollment page through Social Security. So you can click on this button right here, apply for Medicare only. So this would only apply for Medicare, not Social Security enrollment. So if you just want Medicare only, you can click apply for Medicare, and that'll take you right to the enrollment page through Social Security. You'll click yes, I understand and agree, and hit next. And then you can start a new application. And you can say, I'm applying for myself. And now you need to create a My Social Security account if you haven't already. So if you haven't, you'll click no, yes, we have an address in the US, and hit next. And then you'll create a new account. And they're going to ask you some pertinent questions to verify your identity. I agree, hit next, then you fill in your name, and away you go. So if you have a spouse or a significant other, it's a good idea to have them present with you when you do this, because there will be a few security questions that verify your identity. And if you forget the answers, maybe you can jog your spouse and they may know the answer. That's to protect your identity. So once you've created a user account through Social Security, then you can apply for Medicare, and it might take up to 10 minutes or so, give or take, depending how quick you are on the application online. This is the preferred method, is the online application. If you wait to apply for Medicare Part A and or Part B, and you can apply for just Part A only, by the way, if you're working, and there's no charge to apply for Part A, and I actually recommend doing that. That way you'll have a Medicare number for later on when you do apply for Part B. If you wait to apply for Part B due to an employer insurance being in effect, then once you're past age 64 and 4 months, then you're going to want to download a paper application. So you'll fill this paper application out yourself, and then you'll fax it, and it's just one page. And here's why you want to apply for Part A when you turn 65, because this application is going to ask you for your Medicare Part A number. So if you don't have Part A, you won't have that number to fill in. So again, there's no cost to apply for Part A only if you're working at age 65 and beyond. Some people are on Medicare due to a disability as well. So people who are on Medicare disability have been on Social Security disability for 24 months. So people on Medicare disability may not have as many options such as supplemental insurance. So just be aware of that. If you have Medicare disability, we can talk to you as well. But your choices may be more limited in most cases for Medicare supplement insurance, not Medicare Advantage. You can get Medicare Advantage as long as it's offered in the area you live in. So once you filled out this form here, then you want to fax it in to your local Social Security office. So we have a link to that as well. You can put in your zip code, and I'll use our zip code here at the office, 98902. And here's the fax number right here. So you'll fax that in. The other thing you're going to need to do, though, is you're going to need to fax in an employer verification form, or your employer can fax that in as well. So this form, I recommend you send in along with your paper enrollment for yourself. So there's two forms. There's the employer verification form, which proves that you had employer insurance, because Medicare is going to want to know, why didn't you sign up for Medicare when you were first eligible at age 65? Why are you waiting till you're 70? Well, the reason is I worked these 5 years. So they need proof of that. Your employer will fill out this one-page form, and most employers will be familiar with these forms. You can email them this form or you can take it in, and they need to fill this out. I recommend that they would either email it back to you, send it back to you in the mail, or you pick it up from them so you have a hard copy of it yourself. Because with the government, you want to make sure that you have a copy of it just in case. So this form, as well as the Part B application form, will need to be sent in to the local Social Security office to these fax numbers. Once you fax it, then I would call your local office, not the government 800 number right here, which is the national number. I'd call the local number, which is based on your zip code. Once you call that number, a day or two after you faxed it, you want to verify that they received your application. Don't just assume that they got it. Very important to know. So once that's done, it'll take a couple, 3 months, or actually a couple, 3 weeks, not 3 months, usually, hopefully, knock on wood, to get your Medicare application approved. Once that's done, then you can reach out to us if you choose, or if you have an agent you're working with that you like, that's great. But we would be happy to help you in any way possible. So we can help you with all of the above steps if you get lost or you get confused. It's all Greek to you. Don't play ostrich though. Take some initiative. We want to be here for you, but you do need to take some initiative on your own to get the ball rolling when it comes to applying for Medicare itself. That's the one thing we can't do, is we can't apply for Medicare for you in most cases. Now, we have helped people fax in their form, but you're going to have to sign that form if you apply for Medicare after you're 65 and 4 months. The next step is to make a decision. Then you can decide if you want to get a Medicare supplement plan or get a Medicare Advantage plan, and you want to add a drug plan as well in many cases, or in most cases. And we can help with that as well. And we can help you pick which one of these 10 standardized plans is best for you. Again, with these plans, all companies offer the same exact benefits. The only thing that varies is the monthly amount that you pay. So you want to pick a company that has a good track record, is not just the cheapest one, not just the newest company on the block trying to attract business with a low premium, because if they're offering it for the least, there's a reason for that. The odds are they're going to jack the rate up in a year or two to catch up, to make sure that they are not losing money on that book of business. And companies do that all the time, so just be aware of that. We only represent companies with a long track record that have a good long history with Medicare. A lot of our companies started out when Medicare was brand new. So just be aware of that as well. And you can also download off our website the Medicare and You Handbook, which they send out in the mail each year. So you can click this button here and you can download that. There's a lot of great information in this booklet. And last but not least, on our website, we have a prescription drug plan lookup tool, which I will just show you the main highlights of. If you want to enroll in a drug plan, you can click this tab right here, and you can actually self-enroll. So those of you who are comfortable on a computer, you can click Part D self-enroll. You can enter your drugs, have your Medicare card handy when you do so. And you can also watch an instruction video, and we also have written instructions. It's pretty straightforward overall, pretty intuitive, but we have a video as well and written instructions as well. That's going to wrap up our time today. Thank you so much. Share this video with a friend or a family member, and again, subscribe to our channel. Thanks for taking the time. We hope to talk to you at a later date. Thanks a bunch.